Hello everyone. I am Dr. Uma Devi, Professor, School of Pharmaceutical Sciences. Today we are going to talk about posology. Posology is the branch of medical science which deals with the determination of appropriate doses of drugs and medications. Which involves the study of how much of a drug should be administered to achieve a desired therapeutic effect. So the importance of posology, if you see that, which ensures safety, efficacy, and individualizations, which will avoid the adverse. Primary goal is to maximize the therapeutic benefits while minimizing the adverse effects or toxicity for each individual patient. So, the optimum dose can change for many reasons. For example, it depending upon the age of the patients and gender, body weight, emotional factors will influence the deciding factor for the dose. The clinical state, route of administration, and drug responses, which also play a main role in selection of optimum dose. Let us see one by one. The age is a primary factor to decide the dose. We have the different categories in human beings like neonates from birth up to 30 days. We call it as a neonates, an infant up to 1 year, and children and adult and geriatric patients. The dose will be differ. Neonates, infants, and children have less developed hepatic and renal systems. The older adults often have reduced renal functions, slow in their hepatic metabolisms, and slower intestinal absorptions. So the drug absorptions from the intestine becomes lower in elderly populations. So the less dose will be given for the old age populations. Gender is another deciding factor while selecting the doses. For example, female patients, especially during menstruation, pregnancy, and lactations, so they need different dose levels. For example, strong purgatives such as aloe should be avoided during menstruation. So, some drugs can stimulate uterine smooth muscles, cross the placenta, or be excreted in the milk. So, during lactations, the drugs like antihistamines, morphines, and tetracyclines, which are excreted in milk, should be avoided. So now body weight is the another factor. We will see that. So the average dose is mentioned either in terms of milligram per kg body weight or as a total single dose for adult weighing 70 kg. So it should be calculated according to the body weight in case of obese patients, children, and malnourished patients. So the route of administration, if you see that intravenous doses of drugs are usually smaller than the oral doses. So the route of administration also very important while selecting the dose. The time of administration. The drugs are more rapidly absorbed from the empty stomach as the presence of food in the stomach delays the absorption of drug. So the food can delay the absorption. So some irritating drugs are better tolerated after meals. So now we will see that some of the other factors also will influence the selection of dose levels. Environmental factors like daylight, if you consider, it will act as a stimulant which will enhance the effect of stimulating drugs, but daylight has diminished the effect of hypnotics. So emotional factors the female already we said the emotional than males which require less doses and inner doses forms some of the which resembles the actual medications and the physical properties are known to produce therapeutic benefit in diseases like angina pectoris and bronchial asthma. The presence of disease, fever, renal impairment, and other diseases can alter the tolerance and eliminations and toxicity. So, during fever, a patient can tolerate high dose of antipyretic than the normal person. Streptomycin is excreted mainly by the kidney, may prove toxic if the kidney of the patient is not working properly. So, the disease conditions will play a role in selecting the dose. So repeated dosing and combinations can change the drug effects. So the accumulation of drug, the cumulative effects are usually produced by slow excretion, degradation, and a rapid absorption of the drugs. So repeated administration for a long period, it produces high concentration in the body and toxic symptoms. Like digital is one of the examples, and heavy metals also will, if it is accumulating, it produces toxicity. Drug combinations can change the drug effects like additive effects, synergism, and antagonism. Synergism combined action is increased when you combine the two drugs together. In case of antagonism, one drug opposes the action of the another one. This is useful in poisoning treatment. And sometimes the unusual responses will be produced due to the idiosyncrasy, tolerance, and tachyphylaxis. So, metabolic disturbances can alter the drug effect. For example, a fever, salicylates reduces body temperature when the temperature is raised. They have no antipyretic effect at normal temperature. Changes in water electrolyte balance and acid base balance, body temperature, and other physiological factors can modify the drug response. Another example, if you see that the iron absorptions from the GIT is greatest when an individual has iron deficiency anemia. So dose calculation, now we are going to see how we are going to calculate the doses based on age, body weight, and surface area. So based on age, we have different formulas like a Young's formula, Dirling's formula, Freud's and Cowling method for estimate a child dose from the adult dose. And based on body weight, we have the formula called the Clerk's formula, which relates the child dose to weight in pounds. And another method we have that is from surface area. So Quetzal formula relates a child body surface area to adult different surface area. So from there we can calculate the dose. So now child dose from the adult dose. The first one is Young's formula. Child dose is calculated from age in years by age in years plus 12 into adult dose, and from the, based on Drilling's formula, age in years by 20 into adult dose, and the Freud's formula, child dose is calculated from age in month by 150 into adult dose, and in Clerk's formula we are using the weight, so weight in pounds by 150 into adult dose, and Quetzal's formula, child's body surface area we are taking into account in meter squared by 1.73 meters squared. This is the average body surface area of the adult. So safe dosing begins with the patients, not the average. We need to confirm the dose and check the prescribed amount and frequency against the authoritative reference of the prescriber. Assess the patient. Consider the age, weight, disease condition, and route of administration, timing, metabolic state, and likely sensitivity. So watch the response. Look for the benefit without any toxicity and without any accumulation. So we have to administer the dose. Now let us see the calculations from the Young's formula. It is applied children's under 12 years of the age. So here the child dose is calculated from age in years by age plus 12 into adult dose. For example, paracetamol, the adult dose is 500 milligram. The child age is 6 years. So as per this formula, the child dose will be 166.7 milligram. For Brufen, the dose for adult is 400 milligram. For child age is 8 years. As per the Young's formula, the dose will be 160 milligram. For amoxicillin, adult dose is 500 milligram and child age is 5 years. So as per the Young's formula, the child dose will be 147 milligram. Now we will see the another formula, that is Drilling's formula. This is applicable for the children between 4 to 20 years it is, and a child doses age in years by 20 into adult dose. The child dose for paracetamol for 6 years is, as per Young's formula, we have seen 166.7 milligram. As per Dilling's formula, it will be 150 milligram it is. And same Brufen, what we have seen as per Young's formula, it is 116, and even in Dilling's model, it is 160 milligram. For amoxicillin, the adult dose is 500. In Young's formula, we said for 5 years of child, it is 147 milligram. In Dilling's formula, it is 125 milligram. So now we will see and follow the Cowling's formula. It is for next birthday that will be calculated as a age. So age for next birthday by 24 into adult dose. For example, the same acetaminophen for 400 milligram drug it is for 6 years of child. So the dose will be 116 0.7 milligram. For Brufen, as per this method, for 8 years of child it is 400 milligram of drug it is. So the dose will be 150 milligram it is. So another formula is Freud's formula. This is applicable for the infants and up to 12 years of age. So child doses age in months by 150 into adult dose. Here child doses 9 for 9 months of child. 400 milligram of drug dose will be 24 milligram. So cetran, it is adult dose is 8 milligram. If for infant age of 9 months, this dose will be 0.48 milligram it is. So now we will see move on to the dose proportionate to the body weight. It is Clerk's rule based on body weight. So weight in kg by 70 we are taking it. So for 400 milligram of adult dose, the child weight is 21 kg. Now the dose will be 120 milligram. So when compared to the 70 kg of adult, so the dose for 21 kg child it is 120 milligram. So dextromethorphan cough syrup it is for adult dose 20 milligram, for 21 kg of child it is the dose will be 6 milligram. If you apply follow the Clerk's rule it is diphenhydramine cough syrup, that is also one of the child medicine we are using, and for adult dose it is 25 milligram. For child's weight 14 kg, the dose will be 5 milligram it is. So these are the comparison chart as per this Clerk's rule estimate for dextromethorphan and diphenhydramine and ambroxyl hydrochloride it is. So now we will see the dose proportionate to the surface area as per Cutsel's formula. Child doses age in years in square, year squared by age in year squared plus 22 into adult dose. So this is